Thank you very much, Lisa, for that presentation. It was very interesting. So I'm presenting on behalf of my colleagues from the University of Sydney and the General Directorate of Animal Health and Production in Cambodia. So firstly, I'd like to cover what is a para-veterinary professional. So in a developing country setting, these are individuals that are usually nominated from their village or their community. They undergo training, usually about of a month's duration. It's relatively rudimentary, and they're involved with providing animal health services to communities which are restricted from accessing the national veterinary services. So a lot of these individuals work in very low-cost settings. Here we've got an example of a village animal health worker in Laos vaccinating cattle. So this is called a bleeding pole. It's usually a metal pole or a piece of bamboo that's strung up next to a tree, and it's used like a swinging head bale. So these are the conditions that they're usually working in, and they're quite vital for these low-income settings. So, and secondly, why are we investigating antimicrobial use? So as we've heard throughout this conference, antimicrobial use is a major issue at the moment, and our previous studies have indicated that there is high levels of inappropriate use of antimicrobials to treat viral diseases such as foot and mouth disease. In a presentation that I gave yesterday, our data showed that in FMD endemic countries, for example, they're actually recommended to use antibiotics to treat FMD affected animals. And the reason why we see this is generally in these settings, the knowledge about disease pathogenesis is quite low. You know, there's not, not a good understanding of germ theory. They're not sure where diseases are coming from and what treatments should be provided for each disease. So we conducted a study in 2015 of 80 village animal health workers. This was a follow-on from a larger study in 2008, which was able to interview 445 village animal health workers in Cambodia. So we looked at things like their training, what diseases they see in their villages, how they treat diseases, and the incomes that they create from their village animal health worker activities. So in 2008, as I said, they were able to interview 445 village animal health workers. These were from 19 provinces in Cambodia. In 2015, we conducted a much smaller survey. It was 80 village animal health workers from 2 provinces. These were one-on-one interviews, and they were all conducted in Khmer language. So this was to hopefully reduce some of those translational errors. So results from our 2015 study showed that the majority of our village animal health workers were receiving training from government or NGO, so non-government organisations. With what we've seen with non-government organisations, a lot of this training focuses on the disease issue at the time. So since the avian influenza epidemic has started, a lot of the training has been focusing on HPAI, and this takes away some of the focus from other important transboundary animal diseases. In 2008, we had 74% of our village animal health workers were using antimicrobials to treat FMD. And in 2015, this went up to nearly 90% who were using them for FMD. We had 83% who were using them to treat pigs, regardless of the cause of the illness, and 34.5% using them for poultry, again, regardless of the cause of the disease. So what we tried to look at were behaviours that were linked to antimicrobial use. So for FMD in cattle, village animal health workers who waited until more animals were sick were 6 times more likely to use antibiotics. Now, this is something that we discussed yesterday as well. They can use antibiotics to treat FMD as an income revenue. So the more animals get sick, the more animals that they can treat and the more money that they can create. With poultry, it was associated with the length of employment. So village animal health workers who were employed, who'd been in that role for over 10 years, were 3 times more likely to use antimicrobials for poultry. And for pigs, it was related to where they received training. So village animal health workers who received training, sorry, that's meant to be from provincial vets, they were less likely to use antimicrobials for pigs. But then those who received animal health training were 4.4 times more likely to use antimicrobials in pigs. So this data, it's quite interesting, and it is worth looking into a bit more and seeing why these behaviours are related to certain training activities. So, sorry, I think I've sped through this. So in conclusion, with our village animal health workers, we need to improve the mentoring and supervision that they receive from the national services. We need to increase the regulation around the supply of drugs. And in regards to the question that I think Lisa got, in Cambodia, for example, you can access any type of antimicrobial from the local market. So you don't need to get them from a controlled source. So we do certainly see antimicrobials used in livestock, which in the developed world are not allowed. What we need to aim for is a preventative medicine-based model. So we need to start encouraging our village animal health workers to focus on preventative medicine. So creating an income from vaccinations, from advice on nutrition and reproduction, rather than focusing on solely treating animals when they get sick. So one way that we can do this is creating more resources available for farmers and village animal health workers. So what we do in our projects is we try and encourage biosecurity. We're trying to teach them about what needs to be used in FMD situations. So this is an example from one of my colleagues, Jim, from EpiVet. So it's just, short, simple cartoons. This can be translated into local language depending on where it's setting. And it's just to educate the farmers and the village animal health workers about what needs to be used. So, antibiotics is not to be used with FMD because it's not going to make a difference. There is, what I have noticed with talking with our colleagues in Cambodia, is there is a lot of concern about secondary infection caused from the lesions in FMD, and they feel that an injectable antibiotic will prevent this. So I'd just like to acknowledge my colleagues from the General Directorate of Animal Health and Production who were involved with conducting this survey, the village animal health workers and the farmers that we work with in Cambodia, the Australian Centre for International Agricultural Research, ACR, which funds our collaborative project between the General Directorate of Animal Health and Production and the University of Sydney, and the team that I work with at USyd.